Now, excess deaths in 2022 were among the worst in 50 years. This is more than 650,000 deaths registered in the UK. That was 9% more than 2019. And there are big questions. It's deeply concerning in regard to what is happening here. It's one of the largest excess deaths level outside a pandemic in 50 years. It's prompted questions about why more people are dying than normal. There are pandemic effects on the health and NHS pressures, but there is a big question as to why there is no pressure in the government to hold a rigorous inquiry into excess deaths, as I think they should. So what is behind all this? Dr. Charles Levinson is a doctor and he's medical director of Dr. Call, who provide GP and vaccination healthcare. Charles, you're very welcome to talkTV today. What is behind this? What do you think?
So I think those of us who were sort of at the front line, sort of on the ground, seeing patients during the pandemic and during the lockdowns, we realised, we could see at the time that there were very significant problems coming out of lockdown. We were seeing people who were presenting much too late. And it could be simple things like someone with a cough who had let it become pneumonia before they'd called out a doctor, or someone with a bladder infection who let it become a proper full-blown kidney infection before they'd called out a doctor. But then as it progressed, we started seeing people with, breast lumps that they hadn't, or changes in bowel habit, which are a sign of possible that you're at risk of bowel cancer without having done anything about it. And we saw a huge number of people with mental health problems. And of course, it took a long time for that to feed into the statistics, because most of those things don't kill you instantly. They take a while to really take effect. So we saw this coming, and we've been banging on about it. And it's not just us at Dr. Call; it's been other people as well. But it has it wasn't taken into account enough, and we were given lockdowns that have led to all sorts of knock-on effects.
So, I mean, do you think these deaths can be blamed on COVID policies?
Well, I think it's. You obviously want to be open-minded. It is hard to find anything else that has really changed over the last few years, other than this, any big significant changes in sort of behaviour, other than the lockdowns and the fear of people had of going out, and this idea of protecting the NHS to save lives and avoiding doctors and so on. So, I think that and the knock-on effects that has had, because of course then the NHS is now struggling to catch up with the backlog that has arisen, which is another knock-on effect of it.
It's interesting as well in terms of the fact that you say you've been banging on about this, and correctly so. I mean, the government, health authorities, the media as well, they were counting each and every COVID death. But why not these unexplained deaths, do you think? Why, I mean, do people not matter now? Is it just not a thing that people are focused on because we think, oh, well, the pandemic's over and any effect of the pandemic, we've just got to ignore it?
Well, it's easy to say that politicians are sort of short-sighted and our system causes them to have a short-term view. But I think there are reasons beyond that. I think COVID, it was a frightening new thing, COVID, and to begin with, a high month of excess deaths could be a statistical aberration, and then a second high month could possibly be a statistical aberration, and then a third high month possibly. But as they went on climbing, and have now reached the point that they are more than they were in 21 and 22, and in fact for the younger age group, they've even overtaken 20, the height of COVID. So I mean, I think you can't ignore it now, month after month.
It's interesting. I wonder about the role of the public themselves in this as well. Were they reluctant to question these excess deaths because they were so supportive of these draconian COVID policies at the time?
I don't know how supportive they were, but I think there was a big sort of fear campaign. And again, I think that is understandable that that public health involves trying to get corral the public into behaviour patterns that are considered to be desirable. And
I mean, most of the public did what they were told because they thought it was the right thing to do. I mean, they were told constantly that it was the right thing to do.
Yes, but I think another problem that then arises out of all of this is that we have an erosion of trust in our public advice, and that does two really important things, I think. One is it means that when we do have another pandemic, which I'm afraid to say, the experts all tell us we will at some point, it is a case of when, not if, and that it will be more difficult to get public behaviour to change as the authorities may wish. But the second problem is that erosion of trust in the Department of Health and the authorities leads to a vacuum, which then leads to a rise in conspiracy theories. And so now we have a reduction in children being vaccinated against diseases because people, are no longer trust the information they get.
Well, I certainly agree with you in terms of the erosion of trust in public authorities, but it's not just the public authorities themselves. Surely members, I mean, we talk about, and I find it, to be honest, a little bit much when we had clapping for carers and saying, everyone who works in the NHS is absolutely wonderful and, a saint and so on. I mean, we didn't hear surgeons begging governments to reopen theatres for life-saving surgery. Doctors and nurses could surely see what was happening when vital NHS services were turned down. Many of them, and they're not all angels, stood idle as operating theatres were shut. They did their TikTok dances, but they didn't raise their voices on this. Well, is there evidence? Do we know of people challenging health leaders and government at the time who were within the NHS who knew that perhaps excess deaths would be the result of all of this?
Well, I think one of the difficulties we have is that people, we could see it coming, but we couldn't prove it. And there were plenty of people who did. I think frontline people, so primary care, doctor calls a GP service. So we were seeing people long before the surgeons and so on do. There's a long delay before they start seeing changes. But Macmillan pointed out that that there were only halfway through the lockdowns. At that point, we had 50,000 less cancer diagnoses than we would normally have expected. Now, that didn't mean people had stopped getting cancer. Well, it might have done, but that's very unlikely. It's much more likely that they weren't being picked up. And if they weren't being picked up, they were obviously going to come to light later and worse. So there were plenty of people saying it, but you're right, there were plenty of people who probably could have said more.
Yeah. I wonder as well whether there is a conversation to be had in regard to vaccines in this. Are we scared to talk about the vaccines? Could there be some link to excess deaths from the vaccine? Because that's certainly what some people think.
I don't think there's any, well, I'm certain there's no clear evidence of that. And I think that is the sort of conspiracy theory that arises in a vacuum where no one any longer knows what or who to believe. But and that will be a challenge. So as and when we have another pandemic and as and when a vaccine is produced for it, I mean, do we think the public there'll be much uptake of it? I don't know. Well,
I think that's another very interesting point in terms of lockdowns as well, because we know, for example, that some of the lockdowns were imposed for political reasons. We know that masks were imposed through the WhatsApps that my colleague Isabel Oakeshott put out in regard to masks in schools, where that decision was made because Scotland was doing it, not because of medical evidence. It is interesting that, I think it's a legitimate question to talk about vaccines. I personally have very happily had a number of vaccines. I'm actually immunosuppressed and have had probably more vaccines than most people, and I'm very happy to take them. But some people aren't, and they are hesitant, they are worried about that, and that trust is very, let's say for the sake of argument that the vaccine is entirely safe, well, that's still a very difficult thing to convince people of when they've been lied to about other things.
Well, I remember a time when the challenge for getting parents to vaccinate their children against dangerous diseases like measles and so on was that it was difficult to get the people who had the families who had social problems and who didn't have a parent who could take them to the doctors and so on. And or didn't turn up for their appointments, and all. It was now we're seeing educated, people, middle class people, people who we would have normally thought would be the first to line up to have their vaccine.
And listen, John, I totally see your point on that. I don't have children. If I had children, I would be vaccinating them. But you can see why people are sceptical, can't you?
You can, absolutely. And it is. There's always a human tendency to, if in doubt, do nothing. So if someone holds up a injection and says, might this be, this might be good, it might be bad for you. What do you think? Do you want it? You'll say no. But I think in the past we've had quite a lot of faith in medical advice, and I think we've lost a lot of that now.
In terms of excess deaths, just one final question. I mean, there's a memorial wall in London, a multi-million-pound inquiry into COVID, but still no action or an inquiry into excess deaths. Do you think there should be?
We absolutely need an inquiry into it. There's absolutely no doubt. And that then needs to feed into a proper pandemic plan for next time, with using, and if we have to use lockdown, which we could have to, that we use it appropriately, because it doesn't reduce the number of cases, it just flattens the curve.
Thank you, Charles. Really interesting to talk to you there. Dr. Charles Levinson, Doctor and Medical Director of Dr. Call. They provide private GP and vaccination healthcare